Welcome to Henrico Doctor's postpartum and newborn discharge video. In this video, we are reviewing discharge information for you and your baby. If you have any questions after reviewing the following video, please reach out to the members of your healthcare team. First, we will touch on newborn safety. Always place your infant on their back to sleep. Use a firm mattress. Do not place any pillows, blankets, stuffed animals, or crib bumpers in your baby's sleeping area. Never smoke around your baby. Do not allow your newborn to sleep in the bed with you or anyone else. Never leave your infant alone in the water. Always have your baby in a car seat when riding in the car. Car seats should be rear-facing in the back seat of the car for the first 2 years of life. Your infant should be breastfeeding 8 to 10 times a day per infant cues. Wake your baby at 3 hours to feed if they do not wake on their own. Hold your baby upright and gently pat on their back to burp them after feedings. Expect your baby to lose weight while in the hospital. However, they should reach back up to birth weight around 2 weeks old. 1 to 2 wet diapers are normal for the first day or two of life. You should expect 6 to 8 wet diapers of urine a day starting at 1 week old. Your baby's stool will change from a yellow-green to a mustard yellow. You should expect at least 1 bowel movement a day. Newborn skincare. More frequent bathing dries out your baby's skin. Lotions, creams, sunscreens are not necessary at first. Ask your pediatrician if you would like to use one of these. Many infants have white bumps on their nose, which are milia. These are normal and go away in a few weeks. Newborn rash, acne, is normal. It does not bother your infant and do not pop the bumps. Newborn rash goes away on its own in about 6 to 8 weeks. For boys, there's no special care for an uncircumcised penis. Treat the foreskin gently. Be careful not to force it back. If your infant is circumcised, use Vaseline in the gauze on the penis after every diaper change until the circumcision begins to heal, which takes about 3 to 7 days. For girls, always clean from front to back. They may have some blood spotting, also known as a pseudomenses or vaginal discharge, which is normal due to mom's hormones. For umbilical cord care, keep the umbilical cord clean and dry. Do not submerge the umbilical cord under water. The cord usually falls off in 1 to 2 weeks. Avoid using alcohol or Neosporin-like products unless directed by your pediatrician. Jaundice is the yellowing of the skin and eyes that is caused by a buildup of waste products in your baby's blood. Levels usually peak by day 5 of life, but it can last for up to 2 weeks. If the jaundice level becomes too high, it can be dangerous for your infant and may require treatment. Signs that your baby's jaundice level is rising: skin and whites of the eyes become more yellow in color, your baby becomes lethargic, stool is very light in color, and if you recognize any of these signs, you should call your pediatrician immediately. To help control your baby's jaundice levels, feed your baby on demand, place your infant in indirect sunlight. If you notice any of the following signs, please call your pediatrician. If your baby has a temperature below 97.6 or above 100.4, is lethargic, unusually fussy, or irritable, or difficult to arouse when sleeping. If you notice a foul smell of discharge or bleeding from the circumcision or umbilical cord, refusing 2 or more feedings in a row, is persistent and or projectile vomiting, has persistent diarrhea, has signs of rising jaundice levels. If your baby has trouble breathing, exhibiting by flaring of the nostrils or sinking of the chest, has pale blue and or gray skin color, is limp or not waking up or interacting, please immediately call 911. Now we're off to postpartum care. Cramping is normal, especially while you're breastfeeding. You may experience mild to moderate pain as the uterus shrinks back to pre-pregnancy size. It can take 6 to 8 weeks for the pelvic floor muscles to return to normal. Resuming Kegel exercises can help. Postpartum food and diet. Eat a diet high in protein of your choice, calcium and iron. Limit caffeine and avoid alcohol if you're breastfeeding. Increase your fiber and fluid intake to help avoid constipation, and continue taking a stool softener twice a day until you reach your normal bowel schedule. Next, we're covering breast care for breastfeeding mothers. Engorgement is common, but temporary. For relief, apply a warm, moist towel to the breast 10 minutes before feed. Hand express or pump, but only enough to relieve the pressure and soften the breasts. Too much of either can exacerbate engorgement. Most importantly, continue to feed on demand and don't skip feeds. Breast care for formula feeding moms. Your milk still may come in, and if you become engorged, engorgement can last up for 36 hours. To stop milk production, wear a tight bra day and night. Place raw cabbage leaves on your breast. Avoid all stimulation to the breast, and do not take warm showers, pump, or hand express. Place ice packs on your breast and take Tylenol or Motrin to help with your discomfort. Rest and activity. Increase activity gradually, limit stair climbing if possible. Do not lift anything heavier than your baby for 2 weeks. Avoid driving if you're taking narcotics, and you can start driving again when you stop taking narcotics and you're able to twist and turn with ease. Self-care and hygiene. Take showers instead of baths for the first 6 weeks after delivery. Don't put anything in your vagina for 6 weeks. No tampons and no intercourse. To avoid an infection, change your pad each time you use the bathroom, even if the pad does not appear soiled. Bleeding may continue for up to 6 weeks, and color changes are expected, from red to brown to yellow and then white.
So next we're going to talk about self-care and hygiene for cleaning up with your C-section. If your incision is open to air without a dressing, let the soapy water run over your incision, rinse it off, and then pat it dry. Steri strips will fall off on their own and they don't need to be replaced. Don't peel them off though if they start to go. If you have a Pico dressing on, the doctor or your midwife will let you know when it should be removed. If you have a vaginal delivery and you have a laceration with stitches, they should dissolve within 1 to 2 weeks. Keep using your peri bottle until your bleeding stops. You can use American spray and witch hazel pads until your perineum feels better. Always clean front to back. Sitz baths are also recommended. Use them 3 to 4 times a day for up to 2 weeks. Postpartum blues and postpartum depression. After delivery, your hormones fluctuate dramatically and can make you feel moody, frustrated, or overwhelmed at times. These feelings are normal initially, but if they persist after about 2 weeks, call your doctor. Call your OBGYN immediately for signs of postpartum depression and anxiety, which can include a loss of appetite, an inability to sleep, an inability to perform normal daily activities, frequent crying episodes, thoughts of harming yourself, your baby, or anyone else. When you should call your provider. If you have a fever greater than 100.4 degrees Fahrenheit, taken orally. If you have heavy bleeding that's saturating a pad in less than an hour. If you're passing any clots larger than a golf ball, or your vaginal bleeding or discharge has a foul odor. If you've got any redness, swelling, oozing, or separation of your incision, redness, severe pain, or lumps in either breast, tenderness or pain in the lower legs, especially with walking, any pain or burning on urination, flu-like symptoms, severe headaches, blurred vision, black spots in your vision, epigastric pain, nausea, vomiting, or any drastic change in your swelling. If you have chest pain, shortness of breath, seizures, thoughts of hurting yourself, the baby, or anyone else, please call 911. So this concludes our mother-baby discharge teaching.
Thank you for choosing Henrico Doctors Hospital.